It is the dream of every couple that after marriage they will bear fruits. But when that doesn't happen, what next? This is the reason why we are here. Welcome to Fertility Half Hour. I am Clement Barikui, and with me today to discuss this very important topic, infertility, is Dr. Nsika Nyoriko, consultant obstetrics and gynecologist. He is also a fertility consultant. Doctor, good to have you in the studio today.
Yeah, thank you very much. And welcome, viewers.
All right, and also with me is Dr. Okechukwu Kalu. Dr. Kalu is consultant obstetricians and gynecologist and medical director, Life Point Facility Center, Uyo. Doctor, good to have you in this.
Thank you very much. Welcome, viewers.
All right, Doctor, we are looking at infertility today. So straight, one will wonder, this is one word that we've been hearing often and often, but let's just get to know more about infertility. What is infertility?
Okay, thank you very much. Well, by WHO's definition, infertility is the inability of a couple to achieve conception after 12 months or 1 year of unprotected sexual intercourse. It therefore means that most practitioners will advise couples not to seek medical advice until after 1 year of trying. However, there's a caveat. When we know that people are getting married late these days, so a woman that is probably about in her early or late 30s, it's advised that they seek this help earlier. Or if they have a particular problem they already know is existing, then it's advised that they don't wait up to 1 year before asking for help. So, by definition, infertility, inability of a couple to achieve conception after 12 months of marriage.
Yes, doctor, but we also have some people that before 1 year, 6 months into marriage,
exactly. I just told you now that there is a caveat. There are exceptions when one is about maybe 30, 40, in their 40s. You don't have to wait. You go immediately. Start seeking help because age is a major determinant of fertility.
Okay. So you are about going into the courses, but let's just hear from Dr. Nsikak. What are the causes of infertility?
Okay, for a couple to be fertile, you have to have a man with good sperm meeting with a mature man with good sperm. Yes, and a woman with good quality eggs that ovulates. All right, and anatomically, the uterus is the home for the baby. We have the tubes. We have the tubes also that transport the egg and the fertilized egg into the uterus. Now that means that there are problems that are peculiar to the woman, problems peculiar to the man, and also to the couple. For the woman, the commonest and prevailing problem in our society are tubal problems, tubal factor, where you have women who have blocked tubes, which could be caused by infection generally. It could be sexually transmitted infections, it could be infections after delivery, where we talk of puerperal sepsis, could be from surgeries they've had, pelvic surgery they've had in the past that cause what we call adhesions and cause the tubes to get blocked. Also, remember I mentioned that the woman also has to be ovulating, that means releasing eggs and eggs of good quality. So we could have women with ovulatory factors, also have women with uterine factors. So women have their womb damaged, maybe from TOPs, from accidents, from surgeries. Okay. Then there are also women that have other problems like what we call endometriosis and the rest. Then for the men, we talked about the sperm must be of good quality. So if the man has any problem with ejaculation, any problem with his semen parameters, that could also cause infertility. Then there is the peculiar one that we call unexplained fertility. That's the one some people say that one is only God that can explain it. But like I tell people, the unexplained infertility is it's environmental in a way that the area where the people are reside determine what you call unexplained. Like in our environment where we cannot run all tests that are required, there's some DNA test, genetic tests that may not be able to be carried out in our environment, so we may not be able to pick some problems that exist, and then we'll now call that unexplained infertility. But there in other climes, they may be able to identify DNA breaks, problems with the quality of the eggs, problem with the quality of the sperm, and they will be able to, and that reduces the percentage of unexplained infertility. But by and large, we still have that group of people that all the tests are normal for the man and for the woman, and still they still cannot reproduce, and so we say that's unexplained infertility, and that's where we come in. And as Dr. Carlo has said, he has talked about the timelines that exist. So some people already know their problem ab initio, and they come early, while some will try, and that's where we now come in to help them identify the problem and solve it.
Okay, yes, I will come back to you later. But Doctor, he has talked about the environment. You know, when he was mentioning environment, I thought he's going to say that possibly where we stay, it is polluted or maybe something. But can, before now, the issue of infertility was not as high as what we are having today, because when you talked about the environment, that now reminds me, in those days our parents and forefathers were not experiencing some of these things that we are experiencing today. But before we go into that, let's look at what we eat. Does what we eat affect a man or a woman's ability to conceive?
Well, by and large, no. However, for some patients that have low sperm parameters, at times you encourage them to take diet that is rich in vitamin E, zinc, and all that. But by and large, diet has little or no contribution, except also in the case of a condition known as polycystic ovary syndrome, where PCOS is a very predominant condition in our environment, right? And then those people, because of the peculiar problem they're having, there's what they call insulin resistance that is in them. So those ones, almost like diabetes, they're encouraged to reduce their carbohydrate intake and take more nutritious food, right? And then do a lot of exercise. Lifestyle modification is one of the modalities of treating the condition. It's characterized, we're going to take it one day and just look at PCOS as a condition that causes infertility, probably in one of our sessions.
Okay. All right, Dr. Onyeko, when you were in the course of your introduction, you talked about the different causes of infertility. One will now wonder, is it possible that one person can have, can be affected by, can have these various causes at the same time, blocked fallopian tube and whatever?
Well, it's not usual for one person to have more than one factor, but yes, a combination of factors do exist. For example, someone that probably has terminated a pregnancy in an unsafe manner, what we call septic abortion, person could have the wombs blocked and also have the tubes blocked. So you have a problem with the uterus, you have a problem with the tubes as well. And then the husband may also say have a low sperm count. So it's still possible for a couple to have multiple problems. And that's, like I said, we come in there, we see the problems, and we find a way to solve it.
You talked about low sperm count, and when we hear infertility, many people, we just say it's a woman's problem.
Thank you.
It's the man. We don't need to go and seek a doctor. So what is your advice? Let's just talk about that issue from the men's angle.
Thank you. It's really an unfortunate situation that infertility is wearing a woman's cloth. It's unfortunate because truly the male contributes up to 40% of the infertility, while the women also contribute about 40%, while the combined is about 20 to 30% is combined factors. So male factor is a very important aspect of fertility. In fact, it's advised that before you start treating a couple, the first investigation actually is the semen analysis. So it's a couple's problem, not a woman's problem. It's very important to recognize this, that men need to understand that, right? Because unfortunately, truly is wearing a woman's clothes, and it's unfortunate.
Yeah. Okay. So in that direction, let's look at the ways that infertility can be prevented.
Okay. Well, you mentioned something just now that it appears to be that I see the scourge is increasing. Yes, but not really so. It might not really be so. What is happening now is that people are getting married late. Women are pursuing career. A woman is about 32, she does not wait, until they get about 35. By then, their natural fertility, ability to get what they call fecundity, is already half of what it used to be. So it becomes a problem. So career women don't go to seek for help. Don't get married on time. Your forefathers, by the time a woman is 23, 24, she's ready for marriage. Even in the northern part of the country, people marry at as early as 13, 14. Though they may not have start giving birth until they're about 16. So, and that has affected the rate of infertility. As this thing increased, level of infections increased, diseases increased, we have better antibiotics to manage these conditions now. So I think it's more of the fact that many women are getting married late. Then again, in Africa, we have a peculiar situation, the paradox of infertility, where we're talking about overcrowding, high population, but infertility is also prevalent in this country, in this environment, and we cannot neglect the fact that there are a lot of advantages that childbearing gives, confers on the family, on the woman especially, and also on the man. It stabilizes his family when a couple are able to conceive. It gives the man to have confidence in society, right? Even the health trans issues are settled because the woman has a child. So it's a very important thing. Now you ask the question, what are things that can be done to prevent this? The first thing, of course, is to encourage our career women to think of founding a family on time. That's what we should try to do. Then also it's important, the advocacy we're doing today, for people to understand that this problem exists and most of the conditions can be managed. Then for those that cannot be helped by conventional treatment, there are higher other treatment that's also available in the country especially. I can show you that there are so many great fertility experts in the country. And if you seek for help on time, most times you will be able to achieve your dream. So these are the things that we need to advocacy. People should get married on time. People need to know what is causing the problem.
Okay, Doctor, you talked about people getting married on time, but someone listening to us out there will say, but we are trying. As we are speaking, there are a lot of ladies out there that are praying, are crying every day that that they've not gotten their life partner. So it may not be possibly that they refuse to marry early. So, but I don't know whether Dr. Nyoko has something to add to that. Preventive measures.
Okay, preventive measures. Well, we've always talked about, apart from what he said, for the younger ones, the issue of unsafe abortion always comes tops. In terms of causes of infertility, especially uterine and tubal factors. And we encourage women that, if they have a miscarriage, they should go to the hospital to get it treated. We always talk about family planning. We always talk about people avoiding pregnancy when they are not ready, unwanted pregnancy. Because when pregnancy is unwanted, that's when they actually go seeking abortion and then trying to get it from untrained, unskilled personnel and in unsafe places. So that is trying to prevent infection, from getting to the genital tract, and also to advise our women that whenever they have any infective process going on in genital tract, they should seek help from the doctor on time. And also some women that already know about that they have issues that concerns ovulation. They're not having their menstrual cycles are not regular. They will need to seek help on time. They shouldn't just take it as a normal occurrence or something that's always there. For the men, same thing. We also advise that once a man has any infection or the genital tract, he should go seek help, because a lot of times that's the beginning of low sperm count, and it could be difficult to treat in the long run if not tackled immediately.
All right, if not tackled immediately, it will be difficult to treat in the long run. We'll take a break now. You are still watching Fertility Half Hour. We will be back shortly after this break. Stay with us. Welcome back. Thank you so much for staying tuned. You are still on to Fertility Half Hour, and we have been discussing the issue of infertility with Dr. Kalu and Dr. Nyoyoko. So, Dr. Nyoyoko, let's look at the issue of we will be talking about infertility, and I know that some people also want to know: do we have different types of infertility, or we just have only one infertility?
Okay, yes, we have different types of infertility. We have the primary infertility and the secondary infertility. For primary, as the world goes, they've never been pregnant. They've never been pregnant, miscarried, whatever before. And like I said, it could be male factor, it could be female factor. For the males, the problem could be a genetic problem, chromosomal problem. The man is supposed to have a chromosomal complex of X and Y. There are some men that have XXY, XXXY, they have different combinations of chromosomal issues, and so the man now does not have, that matured genital tract, that is supposed to have. Doesn't have the gonads, like the testes. So some men also have problems with their testes not coming down, and the reason why testes is in the scrotum is because it requires some aeration. Does not have to be within a very hot environment. So some people have what we call cryptotidism, where the testes do not come down to school. It's a congenital problem. It's a problem that they are born with. Some have hypospadias, meaning that instead of the opening of the urethra, where the sperm cells come out, being at the tip of the penis, is somewhere closer to the base. So even in the process of having sex, the ejaculate is being wasted, doesn't go in. But for the woman, there are a lot of problems. Problems could be congenital. Some do not have any womb at all. Some, their ovaries are what we call strict ovaries. The ovaries cannot, there's no ovulation. The ovaries are just there as rudimentary ovaries. They don't contain anything. So for primary infertility, most of the problems are genetic, chromosomal, and congenital. Then for the secondary cases, these are people who have attained secondary sexual characteristics. They're supposed to be able to have children, but for one problem or the other, like those factors we mentioned, issues concerning ovulation, maybe they have a polycystic ovary syndrome, they've been pregnant before, but maybe they're not pregnancy or carried pregnancy and delivered, but they've not been able to get another child. And that is problem that has come, that acquired, that come over time, probably through infection, maybe the man having, like I said, everybody should treat the infection on time. Into infection on time, and then it now causes problems with low sperm count, causes other problems like anovulation or blocked tubes, and also issues with the uterus. For some women, even the process of childbearing, they could have complications. Their uterus could be removed in order to save their life. For example, what we call hysterectomy, and such a woman will not be able to achieve a pregnancy. Subsequently, she has been pregnant before, after the child, but complications of childbirth could also lead to that problem. So there are very many, those factors I mentioned earlier can be placed in the secondary, while the primary factors are the ones that they are born with and over time we now discover later that they have a problem that came from birth.
Okay, Dr. Carlo, let's talk a little. You mentioned genetic issue. Let's just a little bit about it. Is it possible that a woman, possibly maybe the mother, it took time, or maybe the mother stayed after for a very long time before conceive? You know, most time we go to hospital, begin to talk about medical history. You know, so family, the issues was her mom. So, is it possible that a woman born into a family that has infertility issue before will also inherit that?
Thank you. That is what the common thought will tell us.
Yes.
But these things don't follow at all. Yes, conditions like PCOS, that's a familiar basis at times. You see siblings having the same polycystic ovary, but they also occur on their own. But most times, people have problems on their own. My woman has struggled to give birth, and the child comes and has 6 children easily. So it doesn't always follow that way, right? It doesn't follow. But we as Nigerians and Africans we always say that this person only 2 kids. I'm sure this person will be able to give birth. It's not really follow.
Most times we say, okay, if your mom had 3 kids, so you are also going to have 3 kids.
No, it doesn't follow. It doesn't follow at all. One can have 6 or 7, and you can only have only 1.
Okay.
For certain reasons.
Okay.
You know,
So
even the economic reasons, a strong one. Why people just have 1 or 2.
okay. So let's while talking, let's look at ways of treating infertility in men.
Yeah. Unfortunately, also infertility in men is not very easy to treat. As you mentioned, many of the causes of infertility for the male is chromosomal. You have what we call Klinefelter syndrome, right? The woman have just maybe extra chromosomes, S, Y, and all that. So they look at their testes, it's not big, and when it is produced, the tubes are not functioning well. So the sperms are not enough adequate. Usually, you expect the normal sperm count to be between 20 million and above, to up to 120 million. So for this person, it's almost 0, right? Then even the duct, there's a duct that carry what they do that, where this sperm is stored, can have problems, right? So there are too many conditions, chromosomal conditions that can cause the male to be infertile. And by and large, most of those ones are not treatable. Most times, for good practitioners, we do certain tests to check them. For those that have this primary testicular problem, we do FSH. By the time you have a very high FSH, very high, nothing you can do for that person. You have to think about doing ornaments to help the couple. That's the truth. Yeah, there are medications that people advocate. You have to select and know the ones to treat. Now there's a part of male infertility that can be managed surgically. You know, when people have problems with their vessels that normally tend to maintain the temperature within the scrotum. You know, because it's required that the temperature is not too high for spermatogenesis to take place. Now when these vessels become too dilated, that means the temperature they can cause temperature changes and cause the sperm not to develop very well. Right? They develop what they call varicoses. So that is amenable to surgery. By proper examination, you can be able to identify the varicoses and refer appropriately. Most times you want to refer to the urologist who can be able to do surgery and tie off this varicoses and there will not be a complete reversal of the sperm count, but maybe someone that maybe azoospermia, meaning no sperm cells, will actually now have some that you can now be able to do ICSI or IVF to be able to help them conceive. So I'm going to use the ornament. So it's a very important way of managing this condition. So these are the ones that may be treated. Then some other persons truly life stresses, life problems can also cause affect the CNS and affect the process of spermatogenesis. So if someone is very responsible, you see that the sperm count can drop significantly. So by advising lifestyle modification and taking some it can help. Then of course, People that smoke, it messes up the sperm parameters, especially fertility. So when a man is smoking and is trying to conceive, we advise strongly that they quit the habit. Even excessive drinking, also alcohol, can affect sperm parameters. So these are all lifestyle changes that can be taken to treat people that have male factor infertility. So somebody can treat them or not.
Okay, so with that we know that some infertility issues in men can be treated, some cannot be treated. For women, well, we leave that aspect of women treatment.
Well, next episode. Very, very important, sir. Thankfully, higher order treatment like ICSI has been involved. That means for those people that have almost zero sperm cells, so once you can see a few, we can actually go to the test list and take some sperm cells and be able to help these men to conceive by doing an IVF process and intrasapose. Okay.
I think yes, Dr. Kalu. I wanted to say that let's keep that up for next episode of the program. Let's not bring it up now so that our viewers can also follow us up. So, but before we go, Dr. Yoeko, your final word. Let's round up from here.
Okay, my final word is that infertility is a problem that's with us. It's not a stigma. People should not see treatment of fertility as a stigma. They should seek help. They should not be shy about it. They should speak out. They should voice out. They should go to the appropriate portals, go to the right persons, those that are qualified and trained in the treatment, in the management of infertility. Those are the places to go to.
All right, those are the places to go to. Thank you so much for being a part of the program. I've been speaking with Dr. Nsika Nyoyoko, consultant obstetrician and gynecologist. He's also a fertility consultant. Doctor, thank you so much for being a part of the program today. And also with us was Dr. Okechukwu Okalu. Dr. Okechukwu Okalu is a consultant of physicians and also gynecologist. He is also a medical director, Life Point Facility Center, Uyo. Doctor, thanks for being a part of the program, and we hope to have the two of you again when we shall meet to handle this issue. Thank you so much, viewers, for your time. I remain Clement Barikui. See you next time.